Welcome to the PublicHealthPreneur Podcast, the show that helps you navigate the intersection of purpose and profit to make impact and income. I'm your host, Quisha Umemba, a registered nurse, public health practitioner, nonprofit founder, authoress, and entrepreneur on a mission to ignite conversations that matter. I've dedicated my career to the pursuit of health equity and to transforming the lives of individuals and communities. And now my passion project is empowering public health professionals to become public health entrepreneurs. My journey is a testament to the potential of this field, and my goal is to ignite that potential within you. Here's what you can expect. In this podcast, we will dive deep into the world of, well, you guessed it, public health and entrepreneurship. Whether you're a seasoned entrepreneur looking to expand your impact, or you're new to the field of public health and consider yourself to be a public health enthusiast, this podcast is your go-to resource for valuable insights and actionable advice, helping you to challenge the status quo and break free from convention to become an unconventional agent of change, creating meaningful and sustainable impact for those you serve. Let's get into today's episode. Welcome to Season 2, Episode 1 of the Public Healthpreneur Podcast. I'm super excited about this season just because it's going to be so much easier to digest. You're going to get short snippets of information, all of Season 2 long, where it's going to be a little bit or a lot bit different from Season 1. So if you tuned in to Season 1 of the podcast, they were longer episode segments and interview styles, and all about the book, all about my book, Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit. Season 2 is not going to be that. So if that's what you like, sorry, I'm switching it up a little bit. I'm giving you some really good, short, sweet information that it's going to be a lot easier for you to take and run with. And we're going to start from the basics. So today's episode, we're talking about what is public health. Of course, I want to share a lot more with you about public health entrepreneurship and certainly how to monetize your skill set to make impact and income. But I want to take it back to the basics for those that are either just in public health or maybe new to public health, to really understand why entrepreneurs are needed in the space. So in today's episode, I'm defining public health for you. Let's get started. Public health is, in a nutshell, the science of protecting and improving the health of people and the communities that they live in. And so as in healthcare, when I worked as a registered nurse, it's very, for lack of a better word, proactive. So people would get sick, they would come to the hospital or they would go to their doctor, they would be treated. That's healthcare. It's actually sick care. It's very reactionary. However, public health is very proactive. It focuses on prevention and keeping people from getting sick or having to go to the doctor or having to go to the hospital in the first place. And so we talk about public health, it encompasses a wide range of activities that are aimed at improving the health of the population. So this is things like disease surveillance, health education, policy development, and environmental interventions, just to name a few. So at the core, let me just say that again, public health seeks to prevent disease, to promote health and prolong life, rather than just focusing on treating people once they've gotten sick. I also want to make sure that I clarify or just make sure you understand when we talk about healthcare, we're primarily talking about individual needs when it comes to health and medicine, even though we do use the term population health in healthcare as well. But that's a big difference between public health and healthcare. One is more individual focused and one is more community focused. I'll say community instead of population so as not to confusion. So there is a mission of public health. And so we're doing this greater good for a number of different reasons. But one, ultimately, is we want to reduce and hopefully eradicate health inequities. And so if you don't know what that is, health inequities are these systematic or systemic disparities in health outcomes among various demographic groups. And so there are lots of social and economic repercussions for both individuals and societies due to health disparities. And these health disparities prevent health equity, prevent individuals achieving the highest level of health that they can. And so some of these disparities are a result of the social determinants of health. And so the social determinants of health are the factors within environments where people live. And so social determinants of health are things like transportation and safety and education, the community that you live in, income, how much you get paid, your education level, different things like that. So that is the mission of public health, ultimately to reduce the effects of social determinants of health, to prevent health inequities, and to attain health equity. Again, health equity is the attainment of the highest level of health for people where everyone has a fair and just opportunity to achieve optimal health. And this is regardless of race, regardless of ethnicity, regardless of disability, sexual orientation, gender identity, one's socioeconomic status, where they live, what language they speak, and a number of different other factors as well. So wrapping up on what is public health, I'll just say that it's really guided by three fundamental principles. And these are just three principles I've come up with. Other people may have three guiding principles, or there might be other references out there that speak to other guiding principles. But as someone that worked in healthcare as a nurse and now in public health as a public health consultant, I'm going to say again, the first is the principle of prevention, preventing disease, preventing injury before they occur, rather than waiting to treat them once they arise. Second is the principle of equity, helping to achieve health equity in all populations and everyone by addressing disparities in health outcomes. And that requires a concerted effort on multiple fronts. So we're talking about people, processes, and policies, and that's a totally different podcast episode. And then the third principle is community engagement. Public health recognizes the importance of engaging communities in the design, implementation, and evaluation of health interventions. And I think that's what's most important, probably, or not even most important. I think that's the biggest distinction of public health, is that we engage the community, because those are where the experts live, right? They're experts on where they live, they're experts on their bodies, they're experts on what works for them and what doesn't work for them. Whereas healthcare traditionally is like, this is what works, this is what we found to work through, some kind of, randomized controlled study, or, through testing out certain drugs or whatever in particular populations. So take this drug or do this treatment because we know what's best for you. Public health is saying we're going to engage the community in the design, again, the implementation and the evaluation of this particular health intervention, because doing that is going to ensure that it is effective and that it is also sustainable as well. So we've talked a little bit about what public health is, and in our next episode, we're going to talk about entrepreneurship and public health. So thanks for tuning in to the PublicHealthPreneur Podcast, the show that helps you navigate the intersection of purpose and profit to make impact and income. I'm Quisha Umemba, the Public Healthpreneur, and I hope you enjoyed today's episode. For all things public health entrepreneurship, be sure to follow me on social media at Quisha Umemba or the Public Healthpreneur. You're also invited to join the Public Healthpreneurs Facebook group, where we continue the conversation after each podcast episode. Need help to start, grow, and scale a profitable public health consulting business? Hire me to be your coach. Want to pick my brain? Buy my book, Public Health Entrepreneurship: Navigating the Intersection of Purpose and Profit, available at all major book retailers and on my website at QuishaUmemba.com. Until next time.